Good morning, everybody. Hopefully you guys can hear me okay. I'm going to talk to you guys for just a few minutes about some of the things that have come across my desk as a pharmacist. Hang on just a second. All right, there we go. All right. Anyhow, I was just want to share with you guys some of the things that I've come across in the last few days regarding the coronavirus. I've been meaning to get this out to you for a couple days now, but it's the first chance I've had to do it. Um, just last night, I was reading a new report on Medscape.com that says coronavirus is aerosolized through talking and exhalation. It says an expert committee has concluded that the novel coronavirus is actually aerosolized through talking and just general breathing, but it's not yet clear yet if the viral particles are viable and are admitted in a sufficient enough dose to cause infection. They just have realized that it is aerosolized just from breathing and general talking. Uh, a physician named Harvey Feinberg, is a physician and a PhD. He's the chair of the National Academy's Standing Committee on Emerging Infectious Diseases. And he said that while the current SARS-CoV-2 specific research is really limited, the results of available studies are consistent with aerosolization of virus from just normal breathing. Uh, Aerosolization could be considered basically transmitted to you in potential three different ways. And the talking and breathing is the third way now. So, I mean, the primary way that it is aerosolized is through sneezing and coughing. So you're near someone that sneezes or coughs, and you can pick up the contamination that way. And that's why the social distancing's been implemented. Also, you can get infected from touching surfaces where folks have sneezed or coughed on. And then the third way now is just from general, breathing, exhaling. Somebody that's positive with it, exhaling the virus, and someone else then inhaling it. Again, they're not real sure if enough is put into the air that way to cause the infection, but it's something that's raising some concern now, and it's probably why the Center for Disease Control is now suggesting that anytime that you're out in public that you should wear some type of face mask. The committee looked into the issue of aerosolization at the request of the White House Office of Science and Technology Policy. The report cited several studies that it said supported the idea that SARS-CoV-2 is airborne. One study, which has still not been published yet, but it's in the process of being peer reviewed, from the University of Nebraska in Omaha, the researchers collected air and surface samples from 11 rooms of patients that have active COVID-19, and found that the viral RNA was in the air inside the room as they expected. But they also found it outside of the rooms of these patients, and also found it on ventilation gates. Another study that's not been published yet took a look at hospitals and public areas in Wuhan. It found that the highest concentration of virus were actually in the toilet facilities, in the rooms where the medical professionals changed their personal protective equipment. So, there's more evidence that it's being spread through aerosolization. In another recent overview in the Journal of American Medical Association from the Massachusetts Institute of Technology in Cambridge, they noted that recent research has found that exhalations, sneezes, and coughs are primarily made of a turbulent gas cloud, a puff. And that puff then mixes with the ambient air and it traps some of the COVID-19 and carries it with that cluster of droplets that from your puff. And they discovered that the lifetime of a puff, of a droplet in a puff, can be anywhere from just a fraction of a second to actually minutes. And they also found, before they were saying that when you coughed or sneezed, it didn't go any more than about 3 or 4 feet. But MIT actually has discovered that a cough or a sneeze can travel as much as 23 to 27 feet. So that's another concern that we have with the spread of this virus, and another reason why we're suggesting that you wear masks. The World Health Organization still contends, this is as of March 29th, the current evidence shows that COVID-19 virus is primarily transmitted between people through respiratory droplets and contact routes, from sneezing, that type of thing, coughing, that type of thing. But it's still, research is now showing that it can be actually airborne, just like I said, from breathing and talking. So the question is it time for universal mask usage? And I agree with what they're recommending now, that it is time for mask usage. Folks, we've been inundated with news stories about the deaths and the economic destruction due to COVID-19, and we hear all about the role of these quarantines and civil disobedience. I mean, the city of Louisville is arresting people on home incarceration, putting them on home incarceration because they're refusing to shelter when they've been tested positive for the coronavirus. And they're going as far as putting ankle bracelets on. So, we're hearing all these things in the news, and we know that testing and tracking is getting better, and, it's reducing the cases of COVID-19. But we've really heard very little about the suspension in the air and how it's passed that away. In the Czech Republic, they've been able to really suppress the death rate because they're taking more serious stance on it than we are here in the United States. In the Czech Republic, they share the distancing recommendations that we do, and all the public and government mandates in order to, shut businesses down. But they're following the recommendations that are coming out of Southeast Asia from Japan and Korea and that type of thing. But what the Czechs also do that's being done in those Asian counterparts that we're not doing is the universal mandated use of a mask. And they've even gone as far as to issue an $800 fine for people that are found in public without using masks. And because they're so aggressive on that, out of 3,000 cases of COVID-19 right now, they've only had 24 deaths. Hong Kong has mandated school closures, and Singapore has strict quarantines in place, and they have strict contact tracing. But both locations have flattened their curves because they are requiring people to wear masks. Japan, they've not been as strict with school closures and that type of thing, the quarantines and all that. But they also have mandated folks use masks when they're in public. And they're not seeing the death rates that are being seen in European, China, the European countries, and even the United States. If we read the research and look at all the numbers honestly, we should recognize that masks keep us safe, folks. Wearing masks was initially discouraged in the United States. Healthcare professionals, including advice from the World Health Organization, told us that only to wear masks if you're sick. The message was that the virus wasn't spread as easily through respiratory droplets and not aerosolized. And we've now found that that's not the case. They even discounted the effectiveness of homemade cloth masks, whether they're padded or two-ply. Maybe they did it to reduce public panic or to conserve resources or just a lack of understanding the efficacy of masks made of various types of fabric. Maybe even because it's misplaced American prejudice because inexpensive masks are what they're widely using in Southeast Asia, and that's what we see people wearing all the time on those newsreels from that region. So maybe it's some type of American bias, thinking we're better than those people, some type of American prejudice. We've all seen those pictures. The Asians wearing the mask during the H1N1 and the SARS scares in the past. Many U.S. physicians said that the masks were useless. This has probably kept us from considering masks up until this point. And we have to be shown the data before we take actions like that. So it's kind of crazy that we've gone this long without requesting folks wear a mask when they're in the public. There's very little data on the efficacy of masks, but there's more and more growing data that it is aerosolized more easily than they thought. So it only makes common sense that anything that's going to block the airflow and capture some of those respiratory droplets before you inhale them is better than nothing. Research studies have been looking at transmission of influenza and that type thing, and they understand in those circumstances that the masks are helpful. So I don't understand why up until now it wasn't something that was recommended. One study took a look at the capacity for different types of cloths and how well they filter. And what they found in the study was homemade masks filtered 63 or up to 84% of the virus in the air. I mean, if you can knock 84% of what you're inhaling out, that might be enough that your body can fight the virus, the little bit of virus you get exposed to, that gets through the mask. It just only makes sense. I'd rather have 84% more protection than zero. So wearing masks in public isn't the complete solution. We still got to do the physical distancing. That's critical. And we know that from the Spanish flu outbreak in 1918, that cities that instituted distancing had a much lower death rate than cities that didn't. So we know that we need to continue to follow those guidelines. We need to continue to wash our hands, and keep our hands away from the face. And maybe the face mask will help us keep the hands off the face as well. Who knows? So, it's important that we take this virus seriously and take the precautions seriously. Hey, Delroy, thanks for getting on there. Donald Willett, thanks a lot. Candy Condor, I appreciate you all getting on here. Eva Hughes, Suzanne Folk, thank you very much for getting on here. Paul Eskew, thanks. Elizabeth, thank you. Appreciate that. I want to talk about a different topic now, still related to the coronavirus, but it's a topic that's on my conscience, has been on my conscience for some time, and it's the moral injury to our healthcare workers, and it's getting worse. And what I mean by moral injury pertains to failing to prevent, bearing witness to, or learning about acts that transgress deeply held moral beliefs and expectations of being a healthcare worker. Physicians and other healthcare professionals were already experiencing a significant amount of moral injury long before this COVID-19 pandemic came along. Physicians routinely encountered barriers to providing the kind of care that they knew their patients needed. Folks outside of the patient-doctor relationship dictated what's best for their patients. And they're dictating these things of patients they've never met. And that's causing a moral dilemma for these physicians. These are barriers that are created by third-party third-party payers or institutions, the Center for Medicaid Services, and all the strict formularies and strict treatment protocols that are out there. It's taken away of a lot of the moral decision making that the physician normally would have and has had in the past. They're having to follow guidelines that may not always fit what their patient, fit the slot for their patient may not fit in that slot. And because of all these restrictions, it's really hurt the doctors. These deeply held moral beliefs are the oath that clinicians took to put patients first long before the COVID-19 occurred. But other folks have been dictating to clinicians what they believe is the best treatment for their patients. And the struggle to put the patient first is a universal struggle pre-COVID-19. The business of the healthcare network. It's taken that relationship of the patient-doctor out of it, and the doctor knows best taking that out of it. And some bean counter somewhere is deciding what's the best for the patient. And now with the COVID-19 pandemic, those same challenges have morphed and even magnified. Joined by new threats that come from the fact that resources like PPE equipment, personal protective equipment, respirators, intensive care beds, they're all very limited resources. The pandemic represents the worst case scenario for infectious disease. It's highly transmissible. It's very virulent. It's a very virulent respiratory disease. And with a period that people have no symptoms, but they're contagious during that period. And that period's highly variable from patient to patient. So by definition, there's no way, there's no preparation in advance for this disease, diagnostically, therapeutically, or emotionally on our healthcare workers. Physicians have been watching and fearing that a tsunami of patients are going to descend on them and overwhelm their healthcare systems, preventing them from adequately caring for the ill patient or even being able to manage their patients' risks. Despite clearly seeing a pathogenic wildfire ripping throughout China and Italy, they see that it's just using up all these resources that they need for their patients. And they see that that's what's coming to America next. We're ripping through personal protective equipment and all these other resources at never seen before rates. And in many U.S. hospitals, while all this is going on, continue to perform elective procedures for weeks after the first alarms of a coming pandemic. And they burn through all this equipment, all these personal protective equipment, everything else, on these elective surgeries for weeks, knowing that a pandemic was coming. So, they continue to schedule these elective surgeries despite the recommendations to cease, because the healthcare system is struggling financially, and these elective surgeries are their bread and butter to stay alive, so they can provide the emergency care and that type of thing. So, there's been clear predictions worldwide of the demand on this personal protective equipment and the consequence of all the supply chain challenges that were coming. So the first COVID-19 case was diagnosed in mid-November that we know of. And now, fully 4 months after the first case in the United States was in January, the dire straits of many U.S. hospitals and their failure to adequately prepare is starting to become really clear. Just look at New York City. They were not prepared for what's hit them now. And nearly 1/3 of hospitals are out or nearly out of the mask and face shields and the respirators that they're going to need. And this represents a situation, moral situation for doctors that they've never been placed in before. Patients are going to be in desperate need for these things, and doctors are going to face the unacceptably high risk to themselves because of these shortages, and they're going to have to make decisions on who gets the life-saving treatment and who doesn't because of the shortage of supply. So this is putting a big moral demand on our healthcare workers, and you're going to see more and more of them that just break down on it. Uh, we see all the news reports about New York City saying they're going to need 30,000 ventilators to manage it, and maybe they've received 1,000 so far. I don't know what the numbers are anyway, but they're demanding that they get all these respirators. But there's other cities throughout the country that need that equipment too. It's impossible to get all of them everything that they need this quickly. So how are these physicians going to make those decisions? How are they going to cope? The situation of finite resources is going to force them to assess patients according to not only their individual needs, but also their needs for the society. What's that patient's contribution of society? And they're going to have to make those kind of moral decisions, and that's something they should never have to face. And it's going to rip apart a lot of our physicians and frontline healthcare workers. There was recently a tweet from an ICU nurse in Michigan who just broke down in tears after working a 13-hour shift treating critically ill COVID-19 patients on ventilators. She said it honestly felt like she was working in a war zone. She said she was ready to break. So she wanted to emphasize that people really need to take this virus seriously. She says that the U.S. healthcare workers are feeling the responsibility, and there's not much they can do about it. The handling of the COVID-19 pandemic in the U.S. is going to go down as the worst public health disaster in the history of this country. Um, Perhaps what we need in the medical community need to remember most is how our local and state governments, and to some part the federal government, has betrayed the system. George W. Bush back in 2005 realized that we could be facing this type of situation at any time. And he put together the task force that we're still hearing from now, and told the governors and the major cities that they need to have stockpiles on hand. For a few years, they tried to do that, but then other things in politics and everything else took them away from that. The crunch of the financial crunch that the facilities are feeling affected that. And I'm not going to lay any blame on any particular politicians or anything, but because of the political and economic situation for the last couple of decades, we weren't prepared. And I don't know what the answer is there, but it's something we need to take more seriously. And hopefully that because of this pandemic, that when we come out of it on the other side, folks will start taking things like this more seriously. I want to tell you about a doctor. It's actually a husband and wife doctor that I read about. They said that not long ago, the weekends, it's Dr. Griggs said this, that weekends were meant for trips to the grocery store, chasing after their two active toddlers, eating brunch with their husband, and just spending some downtime with family. But she said that life has changed dramatically for the family since COVID-19. She said that her and her husband, spent their days off drafting a will recently. They're both doctors, and they know that the healthcare workers have an increased risk of contracting COVID-19, and they felt that they need to take the responsibility to prepare their family, to have a will in place to make their wishes known about what to do with their property and their assets, and who's going to take care of their toddler children if the worst thing happened. Um, they sat down and outlined their final wishes, and that's something that doctors, nurses, and other frontline healthcare workers across the country have been faced to do in recent weeks. She said she's a general surgeon in Boston, and her husband rather is a general surgeon in Boston, and he's no longer returning to New York on his time off. And she knows she has come in contact with many COVID-19 patients at her practice in New York City. So she's not coming home to her children. She had to send her two children off, the age 2 and 4, off to live with grandparents in Connecticut. So the entire family there is just ripped apart. And they don't know how long it's going to be like this. And they don't even know if they'll ever see their kids again because they don't know if they're not going to contract the disease and die. So this is all this stuff is weighing so heavily on the medical professional out there. And folks just don't realize when they do the stupid things that you see them doing. I mean, my neighborhood, just yesterday, one of our neighbors had a cookout. There was 8 to 10 cars there, so you figure at least 2 people per car. So they probably had 20 people there out playing cornhole and just having a cookout and gathering together. It's stupid acts like that that put these healthcare workers at even greater risk, because when they come down with the disease and it spreads throughout their family, that's more resources and more they're going to be expected from the healthcare professionals. So you got to start taking this thing seriously. It's I don't know how else to say it. People are stupid. Young people are not taking it seriously, and I think it's partly because all you hear on the news is how people 60 years and old are the majority of the people that get it. Folks, it's not a majority by very much. In the 20 to 40-year-old age group, it's around 30% of them. In the 40 to 60 age group, it's around 30% of them. The over 60 age group, it's 40%. So yeah, they are the most, but they ain't that far off from the other age groups. And it's not hitting just critically ill people. It's not hitting people with multiple medical conditions like the media would like you to think. It's healthy people are dying of this disease that have no other comorbidities, no other medical conditions under them. So folks have got to start taking this stuff seriously. If for nothing else, so if you're young and maybe you do fight off the thing, but you're still carrying it, you're going to carry it to your grandparents. You're going to carry it to your neighbors. So it's just crazy. Another thing that's happening that's really hurting the morale of physicians and frontline healthcare workers is hospitals across the United States that are preparing for this surge are facing cash shortages, and because they had to postpone all those elective surgeries. And some of these hospitals are laying off non-clinical staff and cutting doctors' pay. They're cutting their pay when they're putting their life on the line. They're going to be putting their life on the line very soon. It's just ridiculous. There's a hospital in Boston where the doctors learned through a video conference that they're going to receive a 20% cut in pay. They're expecting them to be there for the people and risk their life, and they're going to pay them less than what they were paying them during times when none of this was going around. There's furloughs, there's layoffs, some of the benefits are being cut, all to save some money because they're not able to have their elective surgeries right now. So that's just another way that the frontline medical professionals are, being beat down. And this is a time when we need to support them the most. And it's not just the hospital doctors. I mean, you got the doctors that have private practices. They're not able to see patients now, so they're hurting financially as well. They're trying to decide whether they're going to be able to keep their staffs or have to lay everybody off. Some of them are trying telemedicine. That doesn't help with all their staff, but at least keeps some income coming into them. But this is a situation that's affecting the folks that we expect to be at the front of the line in taking care of us. Now, it's a lot to think about, and it's a lot. I mean, I thank God that I'm not in a frontline position right now with everything that's going on. I am still in healthcare, and I provide medications for folks in long-term care facilities. So I'm still considered a critical healthcare professional, but I'm at least not facing folks uh, that have this disease. And my heart goes out for all the medical professionals out there that are having to be on the front line. I mean, I talk to nurses every single night that are on the front line, and they're scared. They're terrified. And we need to make this, this needs to be a wake up call, folks. You know, we've taken for granted our health in this country because we have such a good medical system. We take for granted that there's prescription drugs out there to help us manage our diseases. And that's another topic. You know, we've become so reliant on drugs to manage our diseases that we've not made the lifestyle changes that we need to make in order to uh, improve ourselves, to get our immune system up to its fullest. I mean, things like diabetes and heart disease and arthritis, these are all diseases that if you take some personal responsibility and you change the way that you treat your body, you change the food, you avoid bad foods, you make sure you're getting all the 90 essential nutrients that you need, and then you get off these medications. It's possible to get off of it. We've come to the point in this country where people think that as long as I have my insulin or my metformin and my diabetes is controlled, I can do whatever I want. And now you're seeing these are the people that are getting disease like this first. It's something as a pharmacist I've been passionate about for so many years. Folks, we don't need to be on all these prescription drugs. We can fix our body. Our bodies were designed by God to repair itself if you give it everything it needs. I mean, you cut your hand's going to heal. The cut's going to heal over because your body knows what it needs to do. And the same thing can be done with more advanced diseases like diabetes, like arthritis. It's possible to give your body everything that it needs, avoid the bad foods, eat the good foods, get the exercise, get the sleep that you need, and your body can repair itself. All the cells in your body over time repair themselves. The bad cells die off, new cells replace them. And it's something that we can take control of. So next time this thing comes around, and you know another one's coming. This isn't the last. The way we live in the world, the global economy, the global world now, and the freedom of traveling anywhere in the world, we know more of these kind of diseases are going to come. So this needs to be a wake-up call that you need to take care of yourself. You need to make sure that your body has the ability to fight and have a fighting chance when something like this comes along. I've got a video I'd like for you to watch by a physician friend of mine who's he's been a pathologist, done thousands of autopsies to compare diseases both in animals and humans. He's written multiple books on the subject of nutrition and what you can do to reverse diseases naturally. I've got a video I'd like for you guys to watch. And after you watch the video, there's going to be a place on there where you can take a health quiz. So you can see what you need based on where you are in your health to improve your health, to be able to fight this kind of thing off the next time something like this comes around. I mean, we're not going to fix diabetes overnight, folks. You're not going to fix your arthritis overnight. But within 90 days, you can have a huge improvement on those types of diseases. So reach out to me on Facebook, on Messenger here, and I'll send you a link so you can see that video. And if you want to take that quiz, you can take that health quiz. The information that you put on that health quiz is not shared by anybody else. I'm the only person that's going to see it. And I would be more than happy to walk you through it after you take it and tell you what I recommend that you do based on that information. And if it's things that I can't answer, that physician friend that I have can get me the answers. So just reach out to me on Facebook. Just want to acknowledge some people that are watching. Thank you, Robin, for watching. David Cronin, Danny, Deborah, Donna, Becca, Amy. I really appreciate it. Cheryl, appreciate it. Charlotte, Paula Lee, Glenda. Looks like some of the others I've already said. So I really appreciate you guys watching this, and I hope you share this with everybody, because everybody needs to know that this disease is serious. It's something we need to take serious, and it's something that we all can, as they keep talking in the media, flatten that curve. If we take the precautions we need to take, and we do the things that they're suggesting we do, we all start wearing our face mask and gloves when we go out in public, then we can reduce the number of people that die from this disease. It's possible to do it, but it takes everybody doing what they need to do. And if you see people congregate in your cities and you've got rules against that right now, it needs to be reported to the authorities. Because these people, you may think they're not doing any harm to you, but you don't know who they will pass the disease on that will pass the disease on to you. We've all heard that game, I can't remember what it's called, 7 something of Kevin Bacon, that where anybody in the world can trace themselves to Kevin Bacon within just 7 steps. I took that challenge, and I was able actually to trace myself to Kevin Bacon in 3 steps. So everybody is within 7 steps of everybody else in the world. And if these people don't take the precautions they need to do, it needs to be reported, because you don't know who they come in contact, who they then come in contact, who they then come in contact, that comes in contact with a loved one of yours. I've been on here a long time. Just actually got off of a 12-hour night shift, so I'm going to hop off here. Like I said, reach out to me and I'll send you that video. And if you have any questions, you can private message me. That's fine. I'll be more than happy to answer questions for you, whether it's health related or if you have any questions on COVID-19. I'll try to answer. I'm by no means an expert on it, but as far as getting our health under control, that's something that I've been doing now since 1995, looking at ways to help people improve their health without dependence of prescription drugs. I know it sounds crazy because I'm a pharmacist, but I don't believe that everybody needs to be on all these prescription drugs. I believe that folks can change it. Folks can take responsibility for themselves and can reverse many of these diseases if they just be sensible about it and do what my physician friend suggests. So again, thank you very much, all of you, for watching us. I really appreciate it. I really appreciate all the shares and likes. And again, private message me if you have questions or would like that information that I mentioned, and I'll get back with you. I'm going to be up for just a little bit longer, then I'm going to hit the bed because I've got to work another 12-hour shift tonight. But I will get back with each and every one of you. Thank you again. I really appreciate this. And again, please share this information. It really is critical. It's something that we all need to be taken seriously. See you soon.